Good morning. Today we'll be talking about understanding complications. This is our second program on it because it's such an important one, and we want to touch a lot of different areas to find, to ensure people understand what it means. And we've received a lot of feedback from the first one. Thank you, Dr. Opawoye, Pharmacist Kola, Dr. Odunola. We are really pleased to have all three of you on the program today. We're talking about complications, which are, will be explained in more detail by you all. But we had a session on complications before where it was described that complications can occur in three ways. First, it can be because of just the secondary to the procedure that is done. The second is because of certain issues and problems around what the person who's having the procedure may or may not have done. And then thirdly, it may just arise because of the inherent nature of the person themselves, who they are. So it's just interesting. And what we're doing is we spoke to a surgeon on infectious diseases, and in fact, I brought Dr. Opawoye, who's on infectious diseases, because it's so important to us here in Africa. I mean, infectious diseases cover so much. We have also with us a pharmacist, and we have an obstetrician and gynecologist. So I'd like to welcome you all.
Thank you very much.
Thank you.
Good morning.
Thank you.
Morning.
Morning.
Dr. Wojuola, from your perspective as an obstetrician and gynecologist, can you tell us some of the common complications you've seen in your practice, particularly around pregnancy?
Yes, pregnancy is a very unique state for every woman, and it's a very desirous one for the family at large. But it's not without its own complications, and the complications could vary depending on if patient has a pre-existing medical condition, which could become worsened during pregnancy. And patient could also have none before pregnancy itself and now develop, most commonly preeclampsia. And this preeclampsia is just like an hypertensive disorder that occurs after 20 weeks, the first 20 weeks of pregnancy. And it affects, it has to do with high blood pressure, protein in the urine, and some organ dysfunction as well. And normally we say that it's a progressive illness, meaning that it doesn't stop at the spot it has started. It progresses. It can affect any part of the body, the brain, the kidneys, the blood clotting system, the liver. So any part can be affected during pregnancy. And with all these things, if it affects the brain, the patient can come down with cerebrovascular accident, stroke. Patient can also have renal impairments, acute kidney injury from that. The liver can rupture, the lungs can become congested. That's when they call it acute pulmonary edema, that the patient will be having difficulty with breathing. So preeclampsia is it's a multi-systemic disease, and it progresses, but it has to do with increased blood pressure after 20 weeks. But if you see blood pressure increment before 20 weeks, that person is likely to have had a pre-existing chronic hypertension before pregnancy. So preeclampsia is disastrous, and it's also deadly if not well managed appropriately. There are so many theories that have been associated with it, but I will not want to bother us with those theories. But the end result of preeclampsia, in fact, it can lead to death. It's one of the causes of maternal death. And if not well managed appropriately, patients have preeclampsia, it progresses, and that's when some patients will come and convulse. They start convulsing, start having this convulsion, and once convulsion sets in, some of them, they're already on their road to death, if not managed appropriately and aggressively. So it's one of the medical conditions that could happen in pregnancy. And it's
it's a complication of pregnancy. So it's very interesting because when you started speaking about preeclampsia there, and I started thinking about the three things. So obviously, this is a host condition. So the fact is that if the person has a tendency towards it, they have maybe a pre-existing condition. But that's again goes to number two. If you already have a pre-existing condition, if you go for your antenatal clinic checks early, there's how it can be picked up and how it can be managed because a woman can be referred to an appropriate center. So there's also that aspect that, you know what, even though some of these complications arise, it can actually be ameliorated if appropriate steps are taken in time. And I think that's something also we brought up at the last time was the look, identify those complications arising early. And as you said before, treat them aggressively. So that's one example that's just arising out of pregnancy itself. But as a gynecologist, you also operate, and there are things. So, for example, that you operate or during the process of the actual delivery, because we all know that maternal mortality is a huge issue in our environment, and we obviously as we're discussing this now, identification of some of these critical issues early, seeking appropriate help early can also help to save the lives of our mothers. What about during the actual pregnancy itself? I mean, there's some things that, for example, affect the baby in utero. Sometimes the baby dies in utero, before the mother delivers. What's that? Could that be a complication of pregnancy as well? Why do things like that happen?
Yes, there are so many factors, or there are so many things that can cause intrauterine fetal demise in a pregnant woman. And it could be from either the mother, the baby itself, the fetus itself, and also the placenta. So from the mother, there are so many things. It could be diabetes mellitus. It could be this preeclampsia we're talking about. It could be chronic hypertension. It could be connective tissue disorders. It could be thyroid disorders. It could be sickle cell anemia. It could be anemia itself, anemia as in low blood in the system. It could also be malaria infestation. So there are so many things that could be a cause from the mother side. Now from the fetal side, there are so many things. It could be congenital anomalies. It could be oligohydramnios, polyhydramnios, multiple congenital anomalies from the baby. And sometimes it could also be idiopathic. Sometimes idiopathic meaning that you couldn't find a cause. And as part of the other causes, there are so many from the mother side. Result isomionization could also be a cause. Then from the
Yeah, so
placenta
I think some
itself.
of these things are a bit complicated. Yeah, so make it simple. We're just talking to lay people here.
Yeah, so then from the placenta itself, when the placenta separates without the woman delivering the baby, it could also be a cause of the fetal demise. When the woman has bled a lot during pregnancy as a result of abnormally sited placenta, which we call placenta previa, the baby can also die. When there is trauma to the abdomen in the mother, the baby can also die. Some women will just be going on the road, have accident, it might just be a fall, and before you know it, the baby is dead. So there are so many factors that could
No, but
be.
when talking about the things we're talking about now, because one of the things we're doing when we're talking about complications is we're also trying to educate people, let them know what complications are. Obviously, you've mentioned a lot, but are there any that perhaps we could have picked up early and prevent the death? You see, because for us, preventive health, Doctors on Air is a preventive health, program. And so we want to see what are the things that people should be looking out for in a pregnant woman to say, you know what, and if, for example, we have a mother, a grandmother, whoever, or even the woman herself listening to this program, what should we be looking out for? How can she prevent some of these things from occurring? Or how can she pick up things early to seek appropriate care?
Yes, from the obstetrics point of view, the first thing is you before you build you need to count your costs, and counting that cost comes to the point of preconceptional care. Before a woman gets pregnant, there are some medications, there are some treatments that woman should have so that you achieve a good pregnancy outcome, a positive childbirth experience. So a preconceptional care is very important for all women of reproductive age group. Normally in same climes, there is a preconceptional clinic that you have to attend at least maybe 3 to 6 months before you get pregnant. That will mitigate against anything that can bring untoward events in pregnancy. So that's the first thing. And once a woman is pregnant, normally we say that you book immediately you miss your period. So it's very good and it's very important to book pregnancy early.
When
Once
you
you
say
book the
book, what do you
pregnancy
mean?
early,
Yeah, some people are saying book. Which
you
book?
register, you register,
You
you
know, maybe read
register
a book.
early.
I don't know.
Go
What you're
to
not clear on that.
you register early, you register for antenatal clinic early, and you register in a reputable hospital where risk stratification will be done. They will, as in when a patient comes for registration, we say, okay, this patient is high risk, this patient is low risk. So the high risk patients, there are ways we manage them. The low risk patients, there are ways we manage them. So registering early for antenatal clinic is
And
very important because
identifying the
there,
risk. So the key for it, what
yes,
you're saying is the person needs to come for antenatal clinic early. I mean, we've talked about this in terms of preeclampsia. I was saying, look, go in early. Find out if you're high risk. If you're high risk, then go to a center that you can be managed. If you're low risk, you can deliver anywhere. You can deliver at home. You can deliver. But if you are high risk, there's every precaution needs to be taken to look after you. And so I think this is just an important thing that we need to make sure people take home. Now, if I can just segue into the malaria, because that's not, that's we have somebody and a specialist here, Dr. Opawoye, on infectious diseases. Dr. Opawoye, how does wow, we actually have very little time, but can you just talk very briefly on malaria and pregnancy as an infectious disease and what people should be doing to prevent it?
Thank you very much, Dr. Ajayi. So malaria and pregnancy is quite common because we live in an endemic area with malaria. Though the good thing is that we're not seeing very, very many malaria cases nowadays because a lot of people, if you have been in Nigeria all these years, you have developed some immunity to malaria. Probably some people, they can use their blood to treat malaria the way they have developed immunity over the years. But the pregnancy creates a unique state. Like Dr. Abiola will agree with me, it could be immunosuppressive in some places. The placenta has been found to be a good site for the parasites to stay and all that, So generally, we try to make sure that you, as much as possible, avoid unnecessary exposure to mosquitoes. Very important. Use your nets, your insecticide nets, make sure the doors are closed. And if you need to really go out to areas where you're not sure, you can use the insect repellent, which would help. But then there are systems that we put in place, like the IPT, where we give Septrim to patients at some
I don't want to
particular.
mention drugs on this program.
Okay. So there are drugs that we can give to help to prevent malaria in pregnancy when you book, depending on the time of the baby. Those are things that we do to prevent it. So what we really try to do is to prevent malaria. And for those who are sick, you want to quickly get to your gynae because when you are to your ORG, because when they are sick and you're pregnant, you're looking at two people, the mother and the baby. So this is not a thing of you just go to the chemist and take any drugs. Whatever drug you're taking, you must be careful not to affect the baby. So it's always good to get to a doctor, be tested, and let them treat you appropriately. Thank you.
Thank you very much. Pharmacist caller, thank you for coming on the program. So important to have a pharmacist here. We want to hear from your own specific perspective. What are complications in medicines? What are complications? Are they the same as side effects? Do they also follow along the same lines we were discussing before, as in it could be due to the host, it could be due to something done or not done by the host, it could be due to something specifically to do with the treatment or wrong treatment or right treatment. Could you explain? Thank you.
Thank you very much, my host. It's a great pleasure to be here once again. So we know medicines are chemicals or biological substances, and when it comes to complications, a majority of complications, when it comes to drugs, comes from medication errors. Medication errors in the sense that, okay, if there's a wrong diagnosis, and the wrong drug was given, it could lead to complications of the disease. If the drug is wrongfully administered, for example, an asthma patient that does not know how to use an inhaler, and he starts puffing it the wrong way, and the thing is just going out of his mouth as it's coming in, and so on and so forth. The asthma is going to progress, it's going to worsen up to a stage where he might end up being in the hospital. From the hospital, might have to, go on several procedures and so on and so forth. It could also have to do with the wrong administration of the drug. You're supposed to put it on your skin, you put it in your mouth, and so on and so forth. And so all this put together can lead to complications of the disease. That's the worsening of the disease, or whatever makes it more difficult to treat. I mentioned, medication errors. It's also good to know that when there are drug-drug interactions, or drug-food interactions. For example, we know that when you want to take artemisinin-based, tablets for malaria, you know that most people already know, for example, that you need to swallow them with milk. But if you do that with another medication, for another set of antibiotics, it could actually lead to therapy failure, and now that will complicate the infection. Another example is if you take vitamin C is something we all know from fruits or from drugs. If you try and use it, okay, with certain anti-malaria courses or treatments, it might hinder the anti-malaria from working. Then what do we see? The malaria worsens, and what could have been easily treated would now need to admissions, and so on and so forth. So when it comes to medicine, there's also the use of an overdose and so on and so. For example, there's a drug called the digoxin. It's from the plant digitalis. When it has what we call a very narrow therapeutic window. You can only use it in microgram. That is 1,000 of a milligram. So you can imagine if there was a mistake in calculation of the doctor, and it was written in milligram and it was dispensed like that. If 1.2 milligram of that is used, 1.2 microgram, it could lead to what we call cardiac arrhythmia. The disease will complicate.
Okay. But if
So those are
okay, okay, so but I think for me, those are some of those things you described are errors. What I'm talking about are actual complications just arising de novo out of the medication. So, for example, in dermatology, we have retinoids that are used in people who have acne. And most people just use them and they don't think there's a big deal and they go and buy them over the counter. Well, those drugs are toxic. They can damage the kidneys, they can damage the liver. And you need to be under the care of a dermatologist to use them properly, because complications of liver failure can occur just from using the drug, not because it was overdosed or anything at all, but
yes.
just the fact that you are using that drug. So those, yes,
The use of steroids, for example. Steroids,
yes,
we know we use them in the treatment of asthma and so on and so forth. If you use steroids for just a week, or more, you could use it for 2 weeks, 3 weeks. Some have to use it for a very, very long time. It causes things like edema. It causes, there's your body begins to generate more fluid. You begin to get fat, and then it could lead to a whole lot of things. And that's why, as you have rightly said, it's very important that people use medications under supervision, so that when these complications begin to arise, which we could also call them adverse events, because of the use of the drug itself. It's better to know how to, for example, if you are going to go off some of these medications, you can't just go off, because you have to taper it off. You have to reduce the dose gradually so that you don't end up with more complications. So very, very correct.
Sorry,
thank you. Another one that is, yes.
I'm just wondering, is it safe to say that every drug has a side effect and every drug has a potential complication? Is that going to be a correct statement?
Every drug has a side effect because drugs are poisons. So we have to realize that even people just assume that, oh, because it's over the counter, it cannot cause any problem for me. But even ordinary paracetamol. If you take it in some dose, in some context, or you use it, or you use it as you're not supposed to use it, could cause problems for you. So every drug potentially can cause problems for you.
In fact, I'd like to also add that even drugs that they call natural drugs, Agbo and the like, because people say, "Oh, I'm not taking any normal drugs. I'm taking something natural." Everything has potential.
It's a misconception to think that because it's natural, it cannot cause any problem for you. As a matter of fact, just like I've rightly alluded to while we're talking the other time, because if a drug is a normal drug, how do I say it now? It's a chemical compound that has gone through all the analysis and so on. We know the therapeutic window, we know the dosage, we know all those things. But for most of these organic drugs, natural drugs, many of them, it has not been ascertained the right dose, the right administration, and so on and so forth. So it's likely that if you want to take a tablespoon, you want to take a cup of it because you think it's just different foods put together, you might have taken too much of fructose, or you must have taken too much. And if you are diabetic, for example, and you are taking a lot of some of those fruits itself, even though they are organic and they are not natural, it could even damage, it could lead to more damage. I know of a particular one that people are using a lot now, already people's kidneys. And they just assume that, no, I can take as much of it. And it's very important that we warn people that before you take any drug, you must know the kind of, there are some things we call comorbidities. There are some things we call sequelae. I don't want to bore people with all that. But you have to know the context in which you are taking certain things. Even though they are natural substances, you have to be very careful. Thank you very much.
Thank you. Thank you so much. You won't believe this program is already over. We've actually gone over time, but I want to just rush us and say, can we just have last words from our listeners, for our listeners, please? If I could just start with Dr. Odunola.
Pregnancy is a desirable state, and also maternal death. The death of a woman can affect the family at large. So managing pregnancy holistically is very, very essential in order to avert maternal death. And part of it is antenatal clinics, regular clinic check, in order to identify women at risk and also treat appropriately. Thank you.
Thank you. Pharmacist, Paula, your last words.
So I would like to say that for every drug you take, make sure you take it as prescribed. And also, I also appeal to the healthcare professionals. We need to work together so that in case you want to make a decision, check with other professionals so that we can give people the right guidance to take the right drugs at the right time. Thank you very much.
Dr. Opawoye.
Thank you very much, Dr. Ajayi. It's important to note that we have to be careful with the way we use antibiotics. We use all drugs, but very importantly, antibiotics, because when they are overused, the organisms in your body will get used to them and they will not work when you need them. Anytime you need antibiotics, make sure they are prescribed by a professional and they are used appropriately.
Thank you. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.